report illegal dumping, volunteer and receive service hours to keep Pitt County litter-free for you and me. To get started, visit pittcountync.com.
The Pitt County Board of Health. Never mind. All right, let's try this again. Good evening. This is the November meeting of the Pitt County Board of Health, and I want to welcome you all to our meeting this evening. And I'll go ahead and call this meeting to order at 6:02 p.m. and ask for an approval of our agenda.
So moved. Second.
Thank you. Is there any discussion? All those in favor, please indicate by saying aye.
Aye.
Any opposed? Okay, wonderful. All right, looks like our first report is for our communicable diseases. Brittany Kinder.
Hi, good evening.
Good evening.
I'm not sure if most of y'all know who I am, but yes, I am Brittany Kinder. I'm the communicable disease supervisor, so we're going to give the report for 2024. So just keep that in mind. I just wanted to make an announcement of our team, though. I think Lee talked about that before, or Wes did. We do have some new staff members. Madison Lofton has been with us for a year. She's our TB and our CD coordinator. Her backup nurse is Davina Moore, that came to us in 2025. And what a backup nurse is just a clinic nurse, but just in lieu of Madison being out, she would help support that role. Melissa Daggs is our STD coordinator. She's been in that role for about a year, and her backup nurse is Shay Dickinson. And she, again, is a clinic nurse, but in the lieu of Melissa being out, she would fulfill the STD coordinator role. And then we have Alan Riggs and Alexis Brooks, who are disease intervention specialists. And this is just a little fun picture. We dressed up for Halloween. We called ourselves the CD Busters. We were different antibiotics that take care of communicable diseases. I was metronidazole. We had some rifampin and some isoniazidine and some zithromycin and some doxy, Truvada, and I think some acyclovir, viscyclovir. So we just thought that was fun as a way just to, again, it's always good to help educate anybody, whether it be our coworkers or the community, about the different drugs that we use to take care of communicable diseases. So we are pill bottles, so if that little hat twists us off. So this slide is, we're going to go over our STD rates. So I'm pretty excited to show you this slide because if you don't know, Allison Swart has been working very hard on our CHIP data. And so this information you can find right now currently on the county website for yourself. I did take screenshots of just to the 2024. 2025 is up there for a little bit, but you can see the 2024 data as well. But you can find this information at the fingertips, and it's so great, and that's exciting for us because for a long time you had to wait a whole year, and you don't have to wait a whole year anymore. You can go up there on the website at any time. But as you can see, chlamydia's pretty consistently, unfortunately, still kind of high for 2024. Same goes with gonorrhea. And you can see the rates kind of between the 175 to 205 throughout each quarter. Same with, unfortunately, syphilis hasn't really budged a whole lot and still, unfortunately, high. And we're out there trying to track that down as good as we can. And same with latent syphilis as well. We have our disease specialists, they go out and they really are trying to get these people connected to care and treated. So. And then hepatitis. So that is something that a lot of people don't realize that we kind of monitor. And with a new position we have as the hepatitis bridge counselor that we have at the county, part of his job is to kind of work with these populations that need access to care and treatment. So for example, that hepatitis C, that chronic, where it's 314, that's quite a bit. But that person can work in engaging those clients into treatment. We work real close with the ID clinic and trying to get those people into care so that they can get treated because Hep C is treatable. We had one acute Hep C. We had 16 chronic Hep Bs, 3 acute Hep Bs, and 1 Hep A. So those are the different type of hepatitis that we had in 2024. So germs on the move. We see a lot of different communicable diseases throughout the year. That's, I will say, one thing I'm learning about my new role and as the CD supervisor, you never know what your day will bring. You think, oh, this is going to be a good day. Well, you get on your NCEDs and things are different. So this is not limited to what we saw in 2024, but just some of the most interesting ones that we kind of have pop up. So like we said, germs on the move, unique cases for 2024. We're going to go over each one of those. So the first one is Vibrio vulnificus. That's an infection that is acquired through ingestion of raw or undercooked seafood. We had one case of that last year where the individual consumed a raw shrimp before the fishing expedition or trip in Beaufort County. That person became very, very sick and was in the hospital for quite some time, and they did require some leg amputation because of that infection. So very, very dangerous infection to get. So as a friendly reminder, as we are getting invited to our oyster roasts in December, I know that's a big thing around the holidays. It says, this is a myth, and I feel like I've heard this my whole life, that if you're in the R months, the months that end with R, it's okay. No, it's not. So please don't eat raw oysters or raw seafood so that we don't have to call you and say, hey, you got a real bad infection. So that's just a nice little reminder. West Nile virus. So we had 2 cases of that, and that's a viral encephalitis transmitted by mosquitoes. Both the people had to be hospitalized. Unfortunately, one did pass, and the other one was discharged, but they have not made a full recovery. So, Creutzfeldt-Jakob disease. This is a fatal degenerative neurological disorder. I don't have a lot of information on this one, but this particular case, because we couldn't obtain a lot of information, but that's just something you don't hear very often anymore. I know that a lot of people that were in the service overseas and then came back, they couldn't donate blood for a long time because they might have mad cow. So you might know that from donating blood because that's one of the ones on the questionnaires. But this particular person, we didn't find out about their diagnosis until after they had passed. So. Rabies. So we put the the screenshot from the Daily Reflector regarding the 2 cases of rabies on the raccoons in 2024. So rabies is still an issue, and we do rabies risk assessments often regarding, not always raccoons, but, dog bites or whatever kind of animal bites that we might get through the phone call, people calling and telling us about. So, and then tuberculosis. We did have another case in the fall of tuberculosis that was linked to the case in 2023. We did 191 screens between families, schools, churches. It was a great partnership. We do love our school nurses, and we're so grateful for them. They help our jobs when we have, to work with the school system. And so that was a great initiative that we did together to be able to get out and screen those people specifically at Conley. So, pertussis, whooping cough. Again, that's not something you felt like you heard about a whole lot. I know that in the western part of the state, it's a huge problem, but it's creeping its way to the east, and it's becoming more of a problem. So we had 5 cases last year. None of them were connected, and none of them were community transmission. We did have one that affected a local school system where the person did not give it to anybody else, though, thankfully. So I just say, again, we remind people, especially, if there's a vaccine for it, there's probably a good, you need to report it, and you need to also test and not just diagnose and not have a test to prove it. So it's just important to test our population and make sure we're getting accurate diagnosis so that we can do the best job of serving and controlling the outbreaks. And that goes for anything. And this is just an infographic that we got from the CDC, again, reminding people of what pertussis looks like. And the good thing is that, if you do have the vaccine on board, you tend to have like a more mild case. But we just got to think about our vulnerable populations, our young babies, and our elderly population. So again, we should have this in our back of our mind and not just assume it's just a normal cold or common cold. This is out and about in our state. And then again, I wrap up with talking about prevention, because that really is just what we're all about at the Pitt County Health Department. And so Kayla Mannon, our immunization nursing supervisor, did an amazing job, and she does this every year and does a great job of serving our students to get them back in school. So last year in 2024, we saw 286 children to get them back into school. So that's an initiative we've started over the last couple of years that has been so good, and to get these kids protected against communicable diseases, particularly pertussis being one of them as a required one for 7th graders. So that's all I have. I don't know if you guys have any questions, thoughts, comments.
The 286 students is that about what you have every year, or is that less or more? Or what?
I do think that we did have a little bit less this year, but it wasn't because we didn't have as many clinics. We still offered relatively the same amount of clinics. So, and we do a lot of campaigning. I don't know if you've seen the Are You Ready campaigns that go out a lot through social media. And so that's one of our big pushes, and I know our school nurses help with that initiative as well. And we try to get that out to the public starting, in July. I say would be our biggest, if I'm saying correctly. July would be when we really push that campaign, because we know we have to go back to school in August. So, yeah.
Thank you.
Yeah. Thank you so much.
All right, thank you, Brittany. Okay, we don't have any items for discussion. We do have some items for report. Angie, are you here? Okay, wonderful. Can you give us our financial report, please?
Due
to the timing of our meeting being earlier, the county revenues are not booked until the end of the week. So we don't have our traditional finance report because not all of our revenues are ready. However, I'm going to give you an update on the opioid fund because that's not necessarily a fund that we talk about a lot. But it is a fund coming up soon with our opioid applications and everything like that. So I thought we'd do a deep dive into kind of where we are with that and everything. So, alrighty. So currently right now, since August 1st of 2025, we have received $1.3 million, $1,310,677.51 in settlement payments since August 1st. Those payments are a combination of payers such as Walgreens, Allergan, CVS, and a few other payers. Then we have accrued $38,071.82 in interest since July 1st. The opioid balance is approximately $2.3 million currently right now, which includes the $615,000 that is encumbered in contracting that was subawarded last year for the 25-26 year. Again, all that money that was not spent last year is what also rolled over into that total amount, including the $1.3 million that we have. Opioid dollars are deposited randomly. We don't have a set schedule as to when we're going to know when they're going to be dropped to us. We are given an estimate of what we should receive in this year, but we don't necessarily know exactly when they're going to come. So currently, as of date, we have the $1.3 million on the books in hand. We're budgeting to at least be able to award a minimum, if not more, of $1 million this year in opioid settlement dollars during the 26-27 funding application. The funding application, we're going to have our kickoff for our letter of intent in December of this year. So any new dollars that we receive in interest would be included in that funding amount that we could distribute when we start our application process in December, with letters of intent starting then for the allocation for 26-27. I also wanted to give an update, and I hit the wrong button, for where we are with the city of Greenville. So we had a financial partnership with them. We are currently receiving all new settlement dollars. The monies have been combined, and we are receiving their settlement dollars with ours. So there is no difference now between city and county dollars. The old dollars that they still have, we are waiting still to receive the final transfer of $124,489.62. They are taking a resolution to their board, the city, on November 10th, and Caitlin and I will be present to answer any questions that they may have that come up, but we've been working with their city council and their staff to help them designate which strategies they would like those funds to be given to per OSTAT and NCDOJ's guidance. The total that they would be transferred from the city overall to the county would bring that total to $625,365.62. And again, that total is mixed in with the $2.3 million total that we have on hand. The strategies outlined in the resolution are results of multiple collaborative workshops between the city and the county. We've worked really well with the city. We have met both with the city. We've had stakeholder partnerships. The city has investigated different strategies that they feel would help meet the needs that they're hearing from their board, what they hear from stakeholders within their communities. And so it's really led to a lot of introductions of new stakeholders, new meetings, new community partners. Our stakeholder list and partner list right now that Caitlin has met with is well over 120 people that she communicates with. And so we've had a lot of good interest in the upcoming application. We have recently signed on to receive payments, settlement payments from Purdue, which was big. That will eventually add a total of $1.8 million to our opioid settlement fund over the life of the fund. And we continue to receive settlement payments from smaller distributors and pharmacies, and we do receive additional sign-on notices when new settlements become available to sign on to for the opioid fund. So that is where we are at. We are excited to start the process for the sub-awardees for next year, and we're working with the current grantees on their expenditures for this year. Yes, ma'am.
Angie, I do have a quick question. Do you happen to have a list of the companies that are subject to those payments, to the settlement payments?
So we do receive, when we receive a deposit, we do receive what that deposit is for. So for example, if it's CVS, Walgreens, Walmart, Allergan, they will tell us. I can produce a total list of what we've received settlement payments for, such as the payers in those settlements. We can produce a list and get that to you.
That, I'm just interested to see
Mhm.
who's actually been subject to having to pay out those settlements to respect.
Absolutely.
Okay, thank you.
Mhm.
Any questions?
I have one.
Yes.
I know last year we were talking about some of the awards weren't spent as
Yes.
much. Are we seeing that
So
better this year?
we have been in communication with all of the sub-grantees, and that was part of our application process. Caitlin really went through the application and communicated with all of the applicants through the entire application process to make sure that they really budgeted and were truly practical in, can you spend the dollars you're asking for? We have run into a similar issue this year where we have one grantee who is a large organization, and they are running into the situation of their organization and their contracting process is taking much longer to execute and get their contracts through their organization much longer. And so Caitlin has been communicating with them on a monthly basis. In fact, she reached out to them this week. We are doing everything we can to work with them. We have provided all the information to their organization, to their legal department, that this organization has permission to back bill through the execution of our Pitt County contract, which was through July. We believe that working with them and the resolute sheer will of the applicant through this, because this was an organization already doing the work. They actually had contracts in place with the vendors they currently do. Their organization is making them recontract with the vendors because the payer source is different. And so it's just taking a lot longer to get through their legal department than they anticipated. And so we are, everybody else though, however, has worked through any issues that they had in-house and is expending. The people who had problems expending last year that actually did get reawarded are expending beautifully. They're right at their 25% mark where they should be for the quarter. We are actually finding that smaller organizations are able to expend dollars faster and easier than the larger organizations. And what we are truly finding is about $100,000 is about all an organization can spend in a 12-month period. By the time they get through contracting, and these are not necessarily easy dollars to expend due to the amount of backup for audit and documentation that OSTAT and the DOJ need to prove the opioid expenditure. So, but they are expending, but we do have one that has not expended any dollars yet, but we're in constant communication with them, trying to work through their process.
Thank you. Tina?
Yes, Angie, you gave the start date for the letters of intent, December 1, 2020?
Yes.
Yeah. What is
Well,
the
it's in
end-
December. I'm
It's
sorry,
just
don't
in
let me, it's in December, yes. So
Okay.
we have worked out a tentative timeline, and Caitlin, we can send out that full timeline. We're trying to get it started earlier this year so we avoid going before the commissioners during the budget period for review, and really to give the review committee and everybody a little more breathing room. So we do have a tentative timeline worked out. So when the letter of intent opens, that'll be about 2 weeks.
So the letter of intent will open up on December 1st, and the letter of intent will close on January 9th.
Okay, thank you.
And we had our opioid, and then Wes will speak more of that. We had a opioid municipal meeting, and all of our letter of intent information was given out. It is currently on our Pitt County website. Our letter of intent information, all of our grant information is current and up on our Pitt County Health Department website on the opioid page. And there are samples of letters of intent up there so people can know what is needed. Also, there are sample applications up there as well. So people can also see the information that they would need for that as well.
Any other questions for Angie?
All right.
Thank you.
Thank you so much.
All right, Wes, you've got our legislative update.
Thank you. Just a quick legislative update. The North Carolina legislature has adjourned with no budget, no plan to come back substantively until next year, 2026. That means no change in the Medicaid rebase conversation, so we don't see them putting any more money into that. So we're going to see at least 8% cuts in some services. When you look at CPT codes, as Angie's been doing, it could be a little bit higher for some of the procedures we do. So that's disappointing. But federal government continues to remain shut down. We did receive good news yesterday that prior news was November 15th for the WIC program to be fully funded for beneficiaries, but yesterday we got notice that it's fully funded through the end of November. And so that's really really promising. So SNAP still remains in flux. Contingency funds originally weren't going to be used to continue SNAP past November 1st. On Friday, a court case, the judge said that you had to use that contingency funds. So the administration is working on the timeline of that. We think it's going to be about 50% based on the amount of contingency funds that was ordered to be used. Is really only about half of what they need for the whole month. So it could be about 50% of the normal benefit. So as the county manager said last night, if it's $100 you get a month, you get $50, depending on when that actually gets loaded onto the card. And that could take a while. We've heard stories it could be immediate, it could be weeks. We just don't know the speed of when they can be loaded. So if any benefits are still there, they're available. And then once half of the November benefit comes on, again, that could all change if any progress is made on the federal budget. All right, does anybody have any questions about legislative update? Great. Well, can move right on into the health director's update. Just a little bit of information, really seeing positive news on respiratory virus. We've continued to see decreases over the last few weeks, especially since our COVID little spike there in September. 9 patients in the ECU health system. Last time we talked on October 14th, there was 16. It was 34 at the September meeting. So continue to see positive trends there, and no increases really now in flu or RSV. Similar numbers for the outreach division as of September. Healthy Start, 44 preconception. Our target's 46 and 95%, 89 in the prenatals, 40 in interconception. No update for August. These are still the August numbers for high-risk pregnancies and at-risk children. So 270 for utilization, 179 for at-risk children. Nurse Family Partnership, 52 first-time moms in the program currently, and then Healthy Beginnings is 38 moms with a target of 40. Environmental health, for the October numbers, again, red is the change for October. So about 141 additional site visits for on-site wastewater. 90 sites were evaluated. 732 consultations, 12 new construction authorizations, 4 new repairs, and then operational permits issued 22 new for the month of October, so 37 total for the fiscal year. And then wells, 3 site visits evaluated in October, consults about 42, and new permits issued 1. Food and lodging, 213 additional total inspections for the month, 1,164 total consultations in October. That's 142 restaurants inspected, 8 food stands, 8 food trucks, 8 school lunchrooms, 2 schools, 16 child care centers, 11 residential care centers, 4 swimming pools, and 8 tattoo artists. Again, with in vector control, I mentioned 16 bait-in stations serviced, and then 1,525 additional consultative contacts. Nutrition. For the month of September, 4,934 participants. That's an increase of about 100 over last month. Again, our baseline for the year is 4,347, so we're at 114% of our baseline. So we continue to see increases, and we could potentially see increases as people lose access to SNAP benefits, and they're still eligible for WIC. If they were and not getting WIC, they could still apply for WIC. They could still call and be evaluated. So that's September numbers, so we could see an increase in our October numbers. 4 new referrals for DSMES, 1 new enrollment, and then 2 new classes. Again, on the 13th, we're having from 10 to 12 a Living Well with Diabetes event at the new community center. And I mentioned too, Shannon's done a great job. We've got a Facebook Live that they set up on our Facebook page to talk about WIC, to answer any questions people might have, and have some interaction with folks. And then has done several interviews with news media about the WIC situation and to reassure patients about the benefits that are still available. Some of the changes I want to mention as of November 1st, several changes to the WIC-approved foods, mostly related to organics. So still approved organic food are all organic fruits and vegetables. Organic infant foods are still approved. No longer approved organic foods or other organic products, including eggs. So that's your organic eggs. Brown eggs are not allowed. Still, 1 dozen grade A large white chicken eggs are allowed with SNAP. So we have seen some changes in approved foods to cut costs related to organic foods. Again, the Living Well with Diabetes event is November 13th from 10 to 12. Human resources, nothing's really changed since a few weeks ago at our last meeting. We've for the fiscal year, we've had 4 new hires and 2 staff turnovers. And then the dental update since the last visit. So I've included numbers for Dr. Vinson from July 7th when she started through November 3rd, yesterday. So 135 patients seen. That's increased our show rate, 170 scheduled. Our show rate's increased from about 75 to 79%. She's averaging about 8.4 patients a day. Right now we're at South Greenville Elementary, and this is our dental staff. They did a video about how the unit is shut down for a move, how they move it, how they set it back up, and just introduced our dental staff to folks. As Angie mentioned, Caitlin hosted a large gathering for the opioid stakeholders a few weeks ago. This was back on October 21st over at the community center. We had 46 participants come out. So that meeting covered the settlement, the upcoming application process, website updates, feedback on a potential resources platform we're exploring. And then to date, we've identified 122 individual and organizations considered community stakeholders. We've also partnered with Edgecombe County to host a regional opioid coordinators meeting in December to discuss opportunities for collaboration and shared strategies across the Northeast. We've also had some interest from not only northeastern counties, but some coordinators around the state that might be interested in attending that meeting. And again, I'll mention too, we had our last flu shot clinic today for the wellness rodeo, and that's the employee flu shot clinic. So 16 total clinics, 11 different locations around Pitt County. Last year we had 308 get flu shots. This year we had 325. And then we've got the percentage of employees receiving Pitt County insurance. So the 93.9% receive insurance right now. And then estimated cost savings, we kind of looked at what the admin fee charged to insurance for some private companies or offices, around $27. So at 325 employees, we were estimating around $8,775 just in admin fees alone that those represented. And then there's some pictures from the different events. Staff, y'all have a good time, it looks like. Have a great turnout. And then thank you for your attention, and I'll be happy to answer any questions.
Any questions for Wes? All right. Great, thank you. Okay, we have the approval of our minutes from our last meeting. Thank you, Lauren. Minutes were good. Anybody have any comments on the minutes? Any corrections? Okay, I'll entertain a motion to approve our minutes.
Motion to approve minutes.
Second.
Okay, it's been moved and seconded. Any discussion? All right, all those in favor, please indicate by saying aye.
Aye.
Any opposed? Excellent. Okay. Man, I want you guys to pay attention to the time. We're going to join our meeting at 6:33 p.m. Thank you. Do I have another? Do I need to go into close? But I'm adjourning now. I can go into closed session, right?
We'll adjourn
After closed
After. Okay. Out of order then.
Yeah.
Okay, got it. All right. So we are going to go into closed session. It is suggested that the Board of Health go into closed session under North Carolina General Statute 143-318.116 in order to consider the qualifications, competence, performance, character, fitness, conditions of appointment or conditions of initial employment of an individual public health officer or employee or prospective public health officer or employee. All right, welcome back. I will now entertain a motion to adjourn our meeting.
So moved.
And a second.
Second.
All right, it's been moved and seconded. All those in favor, please indicate by saying aye.
Aye.
Any opposed? All right, thank you. We are adjourned.
Building families.